Good afternoon once again. This is Dr. Bhupesh from Dr. BKM is doing the fourth recording for you for the day. Again, thanks to OET for creating this question paper or Cambridge. And my job is to tell you how to do it. So I'm doing the fourth question of the day, that is question number 13. The writer quotes Dixon Wood's reference to intensive care beds in order to, again, this is a question that we first recorded of the day. Purpose. Purpose means why. In order to word always means why intensive care beds reference has been used, why Dixon Wood is using intensive care beds use this word intensive care beds, why Dixon Wood is using these words. Let's see why Dixon Wood is using these words. So as we read in the last paragraph, and the recording is with you guys of the last question. So now this is the fourth question. I have just read this paragraph that Dixon Wood was saying that it is the problem of the multiple hands. It is the problem of the whole system, and individual organization cannot take care of the problems like patient safety, because patient safety is related to many hands: doctors, nurses, patients, hygiene, staff, healthcare workers, other people who are involved carrying the dustbin, throwing the needles, everything makes a concern for patient safety. So now the second paragraph, nowhere is this means patient safety as an issue. Nowhere is this more apparent than the issue of alarm fatigue, according to Dixon Wood. Each bed in an intensive care unit typically generates 160 alarms per day. So if your patient is in ICU, then there are 160 times that alarms buzz caused by the machinery that is not integrated. That means intensive care unit generates 160 alarms because the machinery which is not integrated. You have to assemble all the kit around an intensive care bed manually. Now she's talking something negative, that she's talking about a problem that machinery is not integrated, and manually means humans. Manually means humans arrange or assemble that thing. It does not build, it does not come built as one like an aircraft cockpit. Aircraft cockpit means where the pilot sits. So that means the airplane, then when they are formed, they come as a unit assembled by the machine. Whereas in our hospitals, each thing come differently. Monitor comes differently, this comes differently, wires, leads come differently. Then you have to assemble. That means she's saying that the problem is that intensive care beds do not come as one unit. They are coming separately. This is not something a hospital can solve. It needs to be solved at the sector level. Sector means government. Again, I am telling you, when purpose questions come, last line becomes very important. Now again, I will read. This is not something that hospital can, it needs to be solved. So according to Dixon Wood, problems like this should be solved at an at a higher level. Hospital cannot. So the writer quote Dixon Wood's reference to intensive care beds in order to present an alternative viewpoint. Yes, she is presenting an alternative viewpoint that it can be illustrate a fundamental obstacle, show the drawbacks of, give a detailed example of how to deal with. This can be an answer. Now this question is really challenging because I can find two options which are very hard, three options rather. Present an alternative viewpoint. Yes, she's giving an alternative viewpoint that problem should be solved at the sector level. That is what she was saying now, that no, it needs to be solved. That means she was given an alternative point of view that problem should be solved at an alternative level. Illustrate a fundamental obstacle. Fundamental means basic, obstacle means problem. So she was, illustrate means example. So she was giving an example of a basic problem. Yes, she was giving an example of intensive care bed units. Again confusing. I am unable to eliminate neither A, I am able to eliminate neither B, I am unable. So that means this question is tricky. Now this question should definitely be left for the second round. Whether you do A, whether you do B, even D seems like an answer. Gives a detailed example of how to deal with an issue. Yes, she is giving a detailed example of air cockpit to tell that we can deal it at a sector level. So again, three answers seem to be positive. Can't help it. Please do not do this question in the first round, or even if you do not waste your time. This is the only thing you can do about this question. Do not waste your time. As you know, 11th and 12th question were very easy. This is just wasting your time. Please do not waste it. That is the only suggestion I have. And this is the most important strategy to pass OET exam. Save your time and pass. Simple. Answer can be A, B, or D. In this question, I don't care. I will put a fluke. Most probably, I will do A. Most probably, I will do B according to what my mood is. This question is something that I cannot do according to my level. So please do not do that in exam as well. Please, this is the most important strategy to leave the question. If you want to manage your time in final exam, this is the only way. This is Dr. Bhupesh from Dr. BKM Institutes. I know you want to know the answer, but I don't know. It can be A, B, or D. Anything can be correct. So this question, I'm leaving it at this stage just to remind you and to make you remember that don't do questions like this. Thank you.